Welcome everyone to Emerge Financial Health. It's so good to be with you, even if it's only by Zoom. Thank you to our generous sponsors for enabling us to provide this virtual event for free to all of you. And thank you to the incredible staff of the Financial Health Network, and especially the Emerge team, for producing what I predict will be a rich, fruitful, and inspiring experience. Predictions are a dicey business, especially now, but here's another prediction I'm willing to make. As we emerge from this long and tragic pandemic, those of us here today will play a leading role in catalyzing a movement to improve financial health for all. Through our collective efforts over these many years, financial health has evolved from an idea to a measurement framework, to a strategy, to a field. There are financial health products and solutions, including our new insights platform, Attune. There are financial health tracks at conferences. There are professionals with the words financial health in their titles. But clearly, when only a third of Americans are financially healthy, and when Black and Latinx people are far less likely to be in the healthy category, much work remains. In order to meet the moment that we're in the wake of a pandemic and in the middle of a racial reckoning, we must build a movement to drive the systemic change needed to achieve financial health for all. We're accustomed to the cyclical ups and downs that come with living in a market economy. The pandemic was different, a sudden, unexpected, and lasting event that touched every one of us. And so when our sister or our friend or our next door neighbor got laid off, or she couldn't do her job remotely, or she had to stop working to care for her kids, the importance of good financial health really hit home. When we saw footage of cars lined up for miles outside of food banks, we gained a new appreciation for the fragility of financial health in America. And when it became clear that Black and brown communities and lower income people were more likely to lose their lives and their livelihoods due to COVID, we witnessed the injustice of financial health inequities. Tourniquets staunch bleeding. They give doctors time to save a life. Much of the financial health field has been focused on stopping the financial bleeding. But if we're truly committed to financial health for all, we also have to treat the underlying causes. Work that doesn't pay a living wage, healthcare costs that too often lead to financial ruin without improving health outcomes, college tuition that saddles students and their parents with debts that stunt their finances, lack of access to the technology that has become the passport for productive engagement in society, a care economy that is insufficient to meet the needs of working parents and a growing elderly population. Nor can we ignore the fact that we live in a society littered with legal, cultural, and systemic barriers to economic opportunity and financial security. Race, gender, sexual orientation, and ability should not be factors in one's financial health. And yet the data is clear. Bias is baked in, and demographics are destiny. And that's just plain wrong. Whatever role we as individuals, companies, or communities may have played in building the barriers, if we say we want financial health for all, then it is now our job to help demolish them. And that requires a movement to ensure financial health is a top priority for business, government, and civil society. An effective financial health for all movement needs 5 key elements: broad engagement, a national measurement system, leadership, partnerships, and commitment. I want to talk about each one of those, starting with broad engagement, which is really the crucial place to start. Countless factors influence and are influenced by people's financial health. And we need the full array of financial health influencers to recognize the role they play and begin to take positive action. We know, for instance, that in the workplace, poor financial health and the stress it causes reduces productivity and increases absenteeism and turnover. We also know that worker financial health is heavily influenced by the compensation, benefits, and leave policies that employers provide. And so HR professionals, unions, benefits providers, and worker rights groups belong in the financial health for all movement. We know that poor financial health and the stress it causes contributes to poor physical health, and that negative interactions with the healthcare system can actually degrade financial health. Healthcare providers, patient care advocates, insurers, public health practitioners, and mental health experts all belong in the financial health for all movement. Companies and organizations focused on housing belong in the movement. Groups working on criminal justice reform belong in the movement. The retirement and insurance industries belong in the movement. Colleges and universities belong in the movement. City and state governments belong in the movement. Banks and fintechs all belong in the movement. Just as the pandemic demonstrated that every sector has a role to play in public health, it also has become clear that every sector has a vested interest in financial health. The second element of a financial health for all movement is a standardized national measurement system to record the movement's progress. The Financial Health Network has laid the foundation for this system over the last decade, and our Financial Health Pulse platform is tracking the state of financial health in America and how it changes over time. Today, nearly 100 companies and organizations are leveraging our methodology, data, and tools to measure and improve the financial health of their customers, clients, and employees. What's needed now is a government measurement system that standardizes definitions and data gathering and reports on key financial health metrics with as much fanfare as the other headline metrics like GDP and unemployment. A national measurement system would help shape economic and social policy making and allow us to track progress in boosting the nation's financial health. It could also provide a set of benchmarks against which private sector institutions can assess the financial health of their stakeholders. The third element of a financial health for all movement is leadership, both top-down and bottoms-up. In a recent essay, the dean of the Harvard School of Public Health, Michelle Williams, wrote that she's hearing CEOs discuss the need to add chief public health officers to their leadership teams. We're starting to see a similar C-suite focus on financial health in our work. When Lending Club recently finalized the purchase of Radius Bank, CEO Scott Sanborn announced that Lending Club was officially in the financial health business, and he named Anuj Nayar as the financial health officer for the company. Scott will sit down tomorrow with our chief marketing officer, Laura Barger, to talk about what it means for an organization to define its purpose around financial health. One of the most passionate advocates for financial health for all is PayPal CEO Dan Schulman. PayPal was one of the first companies to embed financial health in its purpose, and Dan weaves financial health into everything he says and does. Does being the operable word, because while he regularly talks about the importance of financial health, he has backed up his words with action. Most recently, through a series of enhanced benefits to give PayPal employees more financial slack in their lives. He also uses his voice and his relationships with other business leaders to champion the cause and encourage them to take action. In 2018, we honored Dan with our inaugural Financial Health Visionary Award, which recognizes individuals who have shown unparalleled leadership in the financial health movement. Tomorrow, we'll pass the torch to a new honoree, Her Majesty Queen Maxima of the Netherlands. Queen Maxima has been a tireless advocate of financial inclusion, with over a decade serving as the United Nations Secretary General's special advocate for inclusive finance for development. More recently, she set her sights on financial health as the desired outcome of global inclusion efforts, and she advocates for the centrality of financial health in both private sector efforts and government policy. Visionary leaders and companies willing to be first movers are important precursors to change, but successful movements don't gain momentum from the top down. They build from the bottom up, from the voices and lived experiences of consumers, the passion of a workforce that demands jobs with purpose, the expectations of a society increasingly turning to corporate America to help solve our biggest collective problems. The financial health movement must begin and end with a deep understanding of people's real financial lives. Our groundbreaking financial diaries research demonstrated the power of deep consumer insight to drive new thinking. And our in-field learning experience, FinX, has put more than 2,000 people, including many of you, in the shoes of the financially struggling to experience the real-life financial trade-offs they face every day. We recently created a digital version of FinX to keep the learning going during the pandemic. People are the experts in their own lives, and there is more work for all of us to do to engage consumers in the research we do, the products we design, and the experiences we create. We must listen to and include them in this movement. The fourth element is partnerships. No single company, government, or organization can deliver financial health. Improving financial health requires solutions delivered across a range of moments in people's lives and baked into complex systems. And that requires collaboration between companies, between the public and private sectors, across markets and causes. Day 3 of Emerge Financial Health features examples of partnerships, such as the one between Fifth Third Bank and the National Urban League, who are collaborating to upgrade the skills of the bank's workforce. Or BlackRock and its engagement with employers and payroll providers and record keepers to create more opportunities for workers to build emergency savings. We'll also hear about the collaboration between Prudential, the U.S. Department of Veterans Affairs, and the Wounded Warrior Project to support the financial health of military families. You can imagine my glee when I learned that the speaker from the Wounded Warrior Project, Thomas Kastner, holds the title of Financial Wellness Vice President. Emerge and the rest of our programming is designed to drive partnerships. For instance, the Financial Solutions Labs Exchange serves as a meeting place for more than 200 nonprofit and fintech providers to explore collaboration and swap insights on how to build high-impact partnerships. Right now, we're preparing to fund some new partnerships to advance the financial health of people who have been involved with the criminal justice system. If you're looking for a partner or for financial support, it's not too late to apply. You can find more information on our website. Broad engagement, a national measurement system, leadership, and partnerships. These are the necessary ingredients of a successful financial health for all movement. And there's one more, commitment. A commitment to financial health isn't a once-a-year emerge moment. It requires unrelenting focus. And so today, I invite you to commit to this financial health for all movement that we're building. Talk to your friends and colleagues about the movement and encourage them and their organizations to take up the cause. Work with us to advocate for a national system of financial health measurement. Lead by listening to your customers and employees, by holding yourself accountable for driving financial health improvements, and by sharing what works and what doesn't. Challenge yourself to break out of your silos and find new partners to drive action. Take a moment now to jot down just one action you commit to taking to build the financial health for all movement. Type it into the chat box on the right-hand side of your screen so we can help inspire each other throughout this day and the days to come. As the word suggests, a movement requires motion. It requires action. And now is the time for action. I am grateful for those of you who have been on the journey with us. Now is the time to deepen your engagement by committing to the financial health for all movement. Onward.